Welcome to the Nursing Arts Simulation Lab at Kent State University East Liverpool's ADN program. In this lab, you will interact with your peers, instructors, and mid-level mannequins to experience, in a realistic environment, scenarios that you are likely to encounter during your nursing career. You may or may not be recorded during the scenario and should have assigned a confidentiality form before you begin your first simulation experience. Let's get acquainted with the simulation lab. As you enter, you will notice the sink where hand washing can be performed. The patient area will also have a pump-type hand sanitizer available for your use. The nursing station area is immediately to your left. You can use the phone to call the doctor, pharmacy, your charge nurse, or anyone else. You will also find a resource book, calculator, and various office supplies and labels there. Your patient's chart will be available to you electronically on the laptop. Please take time before the simulation to become familiar with the electronic medical record and the simulation learning system that we will be using. You will be assigned a demo chart to familiarize you with the EMR setup. The S-bar poster is on the wall above the nurse's station. Please use this format to communicate to other health professionals. You will also have a wall clock for your time reference. On the back counter, you will find assessment supplies such as thermometer, glucometer, pulse oximetry, and Doppler. If you use this equipment, the results of these devices will be told to you by the facilitator. Also on the counter will be bins with supplies such as respiratory equipment, dressing and culture equipment, sterile gloves, a urinary cath insertion tray, mannequin lubricants, irrigation supplies, saline and sterile water. Other small containers have NG and phlebotomy supplies. Clean gloves, PPE, and cleansing wipes will also be available. Linens are located behind the blue curtains. A chart is available for easy location of sheets, gowns, and towels. In the corner of the room is a receptacle for dirty linen. Also in the corner of the room is a cardiac monitoring system. You may or may not be using it in this scenario. You will not be responsible for reading cardiac rhythms if you have not been taught this yet. To the right of the nurse's station is the medication cart. A key to it will be available, and it should be locked when you leave it unattended. In the bin on top of the cart, you will find various shapes, sizes of tape, gauze, alcohol pads, a Tubex holder, pill cutter, med cups, and Band-Aids. Emergency medications and narcotics will be located in the very top drawer. In the middle drawer of the cart, you will find your patient's drawer, which contains regularly scheduled medication you will need for the scenario. The remaining drawers are labeled and contain things such as syringes, insulin, vials, angiocaths, and needleless supplies. Next to the bottom drawer of the med cart has IV tubing, IV start kits, and blood collecting needles. The large bottom drawer contains IV bags of various sizes and types and saline bottles. Now let's move to the patient's room area. In the room is a chair for family member. On the bedside table is a suction machine. Turn it on by turning the middle dial to the right and use the upper dial to adjust the amount of suction. Don't forget to assess the content of the suction container if it's being used. Next, you'll see the oxygen tank. It has a dial setting that can be adjusted for liter flow. To the left of the mannequin is the bedside table. The top drawer contains personal items for the patient, The bottom drawer contains bed pans, urinals, and fracture pans. At the head of the patient bed, you will find an IV pole that may already have various IV bags started with or without a pump attached. You may also see a PCA pump. If it is being used, you can check its settings and history to know the amount of pain medication that the patient has received. If you're not familiar with this IV pump or the PCA, please stop for a short demo. You'll also find a sharps container, a biohazard bag, and a trash can on this side of the bed. Now let's take a look at the mannequin itself. The mannequin responds to your actions and attitude. Listen to the mannequin carefully. The head of the mannequin contains a speaker the facilitator will use to communicate with you as the patient. Although the mannequin can take medication administered through the NG, it cannot swallow actual liquids or pills by mouth. Feel free to move or position the mannequin any way that you see appropriate. Please note that when using the arms, you can move them vertically, but they remain very limited in the horizontal motion. There are many things you can do to assess the patient. You can check the carotid pulse, and although the chest does not rise and fall, breath sounds can be heard best anteriorly and somewhat posteriorly. The respiratory rate can be counted while auscultating. If the suction is on, you may want to temporarily turn it off during the breath sound assessment. Heart sounds can also be auscultated. On the patient's right arm, you can check the blood pressure and pulse rate. The left arm is used for IVs and injections. Injection sites are located in the deltoid. There are also ventrogluteal and vastus lateralis sites on both sides. Bowel sounds can be assessed in these two areas. While continuing your assessment, you may notice the yellow sticky notes, which provide more information about the patient. A urinary catheter may or may not be placed. Although the pedal pulses are not functional, please remember to use the head-to-toe assessment techniques. Please ignore any cables leading from the mannequin's back and the various blood drainage bags located underneath the bed. To maneuver the bed, simply use the controls located on either handrail. The handrails are lowered by pushing on this button. Simulations give you the opportunity to function as a graduate nurse, giving medications, instructing patients and family, and phoning the doctor. Please use normal therapeutic communication techniques with the patient mannequin, the family, and other students. You're allowed and encouraged to think and talk out loud. This can help your instructor know the progress of your critical thinking in the situation. Seek minimal guidance during the scenario. Specific questions or comments can be addressed during the debriefing. A facilitator and lab coordinator will be present. They plan only to provide minimal guidance to keep the scenario running. Using nursing principles and techniques like hand washing and asepsis. Perform procedures as necessary. Remember to use the nursing process as you proceed through the scenario. Assess, remain focused, think clearly, and consider it in a learning experience. When the facilitator calls time, the scenario is over. Take a deep breath, relax, and proceed to the debriefing area as directed. After the debriefing, you may assist with cleanup of the patient area.